If you have a pain in the butt that goes down the leg, you may have been diagnosed with Piriformis Syndrome, deep gluteal syndrome, or maybe even sciatica. And chances are you've been prescribed things like nerve glides or nerve flossing, but these things can actually make you worse. The nervous system is very sensitive, and if you do too much too fast, you can tick it off and keep yourself from healing. Now in seated, this is a classic nerve glide exercise. In lying down, it might look something like this, and there are really a million different ways you can do this, but again, they often make people worse, and here's why. So let's just say this represents a nerve. This is 100% stretch, the most stretch we could place on it. We know that when a nerve is angry, just 8% stretch on it can reduce the blood supply, oxygen, and nutrients to the nerve, which are needed for healing, and just 16% stretch can cut it off completely. And so in this video, I'm going to share with you 3 pain-free exercises to move your nervous system in a way that helps and doesn't hurt. My name is Dr. Charlie Johnson, physical therapist, and after reviewing over 10,000 back, butt, and sciatic pain cases, I want to save you from making the same mistakes that so many others have made. So let's dive into exercise number 1. So exercise number 1 is seated trunk twist. Now you might say, a trunk twist? How is a trunk connected to my butt and my leg? Well, the nervous system goes all the way from your brain, through the spine, all the way into your butt, and down to the bottom of your foot. And so the worst place to start any type of treatment is in the area where the nerve is angry. And this is exactly what you're doing if you're doing nerve glides the traditional way. It hurts here, let's try stretching it. Let's try gliding on it. Let's try poking, pulling on, prodding on a nerve which is already ticked off. That's a surefire way to increase the risk of you making yourself worse. So why not find a remote, safer place to enter treatment, to enter a sensitive nervous system? We know that in the middle of your back, there's a network or a bundle of nerves, which becomes your sympathetic nervous system, your fight or flight nervous system. So why not wiggle things upstairs so that you're not risking making yourself worse? So what you want to do is you want to, in a seated position, find whichever position in seated is most comfy, up tall or slouched, I don't care. And you're just going to twist your trunk once to the left and once to the right. Assuming these are both pain-free, then they both become options to help you out. If they're both painful, we will jump to exercise number 2. Now, if they're both pain-free and they both feel okay, I'm going to ask you to move in the direction that you feel most comfy. So if you had to pick to the left or to the right, and you had to do it 1,000 times, which direction would you pick? Now, before you go ahead and you twist to the side, left or right, whichever you prefer, I want you to test and find a motion which is a little bit yucky. So a common yucky motion or painful motion for people who have sciatica is in fact this motion, which is a nerve glide. So think about that. People are actually having you do the thing which is meant to provoke your symptoms. Not sure that makes a whole lot of sense. But either way, you raise your leg and you say, ow, that causes some problems. Or another common yucky motion for people is a figure 4, especially if they have a problem deep in their glute, a piriformis issue. So go ahead, do your yucky motion just one time and get an idea of how painful or problematic it is. Is it low yucky, medium yucky, or high yucky? Take a snapshot of that. Then go ahead, whether it be left or right, do 2 sets of 20 twists. For me, my left twist feels better, so you're going to do 2 sets of 20 twists, and then to tell if it works for you, you're going to retest that yucky motion just one time to see if it's same, better, or worse. If it's same, that motion, that exercise I just showed you, the trunk twist, is not of value. It doesn't make anything immediately better, which means I have no evidence to believe it'll work in the future. Now, if it makes it better and you feel you can raise your leg further, or there are less symptoms, or the figure 4 is better, then that's something you can stick with. You can end the video, bottle up that trunk twist motion, put a label on it, and do it at a certain dose, frequency, and time. That's the prescription. How much? 2 sets of 20 reps. Frequency, how often, twice a day, and timing before you get most of your symptoms. So if getting out of bed is painful, you do it on the edge of your bed. If you have trouble driving a car, do it before you get in the car. If you have trouble getting out of the car, do it before you get out of the car. The timing of the movement as medicine matters. So that's the trunk twist. Exercise number 2 moves a little bit closer to the area of pain or injury. It should be pain-free. If it's not, we move to exercise number 3. But the whole intent of exercise number 2 is not to move or glide the nerve, it's to move or glide the muscles around the nerve, which is often a safer entry point. So in order to perform this, you're going to lay flat on your belly. And if you get in this position and it's too uncomfortable because you can't tolerate laying on your belly, just put a pillow or 2 underneath your pelvis to elevate this up. All right, but otherwise you're going to lay on your belly. You're going to take the affected leg. So if I have pain in my right butt or my right leg, I'm going to take that. And then I'm going to move it out just a little bit. And I'm simply going to rotate it in a controlled manner and rotate it out. And rotate it in and rotate it out. Now, one thing you'll notice, many people when they do this, their pelvis wants to start to twist or rock. And so you want to stop when you notice it wanting to lift off the table, right there for me, and back. And you're picturing as if your hip and the ball in the hip joint and the socket are kind of just spinning. And you go ahead, you perform 2 sets of 15 to 20 reps. And then how do we know if this is right for you? Well, we go ahead, we retest our yucky motion. Maybe it's the leg raise, we see same, better, or worse, and or the figure 4 motion. If better, that's something we can do 2 sets of 15 to 20 reps, 2 to 3 times a day, and we can time it appropriately just before we get our symptoms. Exercise number 3, again, we're gonna go back on our belly. If belly is troublesome, then just go ahead and put a pillow or 2 again under the pelvis to take that arch out of your lower back. And so in order to perform this exercise, we're not going to lengthen or tug on the nerves, again, which can reduce blood supply and oxygen. We're actually going to shorten the tissues around the nerve. So instead of lengthening it, which can make people worse, what's the opposite of worse? Better, we can actually shorten it. So you're gonna lay somewhere, ideally you can hang your foot off, like the edge of your bed or something like that. That's important. And if you need pillows under your pelvis, that's fine. Otherwise, lay like this. And you're going to, as you bend up, pull your toes up. So not pointed, pull your toes up. Pull it up. You might feel a little stretch in the front of your thigh. And then as you let it down, you're gonna extend the foot. So you're gliding the nerve at the level of the ankle. You're contracting your hamstring, moving the muscles around the nerve a little bit. But you're not really tensioning the nerve. You're just gliding it gently. Now, oftentimes what happens is this. As people bend their knee, because they have some tension on the front of their hips, you'll see that their low back wants to arch. So as they get to this point, they get a low back arch, and then the low back flattens. And then they get a low back arch, and it flattens. Don't let that happen. If that's happening, put a pillow underneath the pelvis and or just monitor it. Meaning if you get to a certain point, you notice the pelvis or the low back wants to tip and arch, stop. That's as far as you want to go. Point the toe, straighten the leg. So again, you can perform this 2 sets of 15 to 20 reps. And how do you know if it's going to work for you? You can go ahead and you can retest your yucky motion. Now, is the leg raise better? Is the figure 4 better? If it is, you can bottle it up, 2 sets, 15, 20 reps, twice a day, and time it when it makes most sense. So there you have it, 3 outside-the-box ways to move your nervous system in a way that should be totally pain-free and immediately effective. It should immediately improve one of your yucky motions. Be sure to just pick one so you can stay scientific on your healing journey. So if you're interested in other tips to heal your butt or sciatica pain naturally, be sure to check out my other videos and let me know in the comments below which exercise worked best for you.